use authorization, and that's such a powerful term, emergency use authorization for a treatment known as convalescent plasma. This is a powerful therapy that transfuses very, very strong antibodies from the blood of recovered patients to help treat patients battling a current infection.
Well, it was big news over the weekend in the fight against COVID-19, convalescent plasma. The treatment relies upon the blood of people who have recovered from the virus. More than 100,000 people have already signed up for it, and more than 70,000 people have gotten the treatment. Studies of convalescent plasma show promising potential, but it hasn't been tested in randomized clinical trials yet. Here to talk more about this and other developing COVID-19 news is Dr. Kelly Victory, a trauma and emergency room physician. Good morning, Dr. Victory. Thanks for joining us.
Good morning, Lauren. Thanks for having me.
Absolutely. Okay, so let's start with the announcement from the FDA this weekend and what that means as far as this convalescent plasma being used as an emergency treatment, because it's already been used in hospitals. I mean, we've talked about it here in San Diego. So was that strictly on an experimental sort of testing basis?
Well, they're still testing this particular treatment for COVID-19, but it's important to note, Lauren, that the use of convalescent plasma is not a new technology. It's been done since, frankly, the late 1800s. In fact, the very first Nobel Prize that was ever awarded for medicine and physiology was awarded to a physician in 1900 for using convalescent plasma in the treatment of diphtheria, a bacterial infection. So we've used this for years for things like measles, pandemic flu, chickenpox, and other things. So it's just being tried right now for COVID-19. Now, it's extraordinarily important because we know that group of people, that group of patients, who's more likely to have a rough go of it with COVID-19. We know it's those people who have the comorbidities such as obesity, diabetes, heart disease, those sorts of things. So because we can identify a group that's likely to have a rockier course, if you will, we can target those folks and think about giving them the convalescent plasma, because that treatment needs to be done early. It's not a treatment that does well if you wait until somebody's in the hospital or, God forbid, needs to be in the ICU.
Yeah, but there's still a lot we don't know about convalescent plasma, when it should be used, the titer, the measurement of how much antibodies are in each, depending on the patient that it was taken from. I mean, there's still a lot we need to learn about it, but it's considered safe.
Absolutely, absolutely. We give plasma to people all the time. Just so people understand, plasma is essentially the liquid portion of the blood. There's the solid part that has the red blood cells, the white blood cells, and platelets. And then there's the liquid portion, the plasma. That's primarily water, but it has other important components like glucose and some of the clotting factors, the things that help blood to clot. It has amino acids, and very importantly, antibodies. So it carries those antibodies from people who have recovered. But as you rightly point out, each individual patient who got COVID-19 and recovered from it is going to develop a different amount of antibody. So the plasma from patient A isn't necessarily the same as the plasma from patient B. And so there is a bit of trying to figure out just how much to give somebody who's now acutely ill or coming down with COVID-19 in order for them to benefit from those antibodies that were taken from the patient who recovered.
Right. I want to kind of switch gears and talk about something we were planning to talk about before this weekend's announcement from the FDA, but this was a comprehensive report out of Swiss Policy Research, a nonpartisan think tank that was taking international data on COVID-19. Can you sort of summarize for our viewers what they found in their study?
Boy, it's a great report, Lauren. I'm glad you brought it up because it really is a comprehensive report on international data regarding COVID-19 from the very beginning of this pandemic. And it should be said that the Swiss Policy Research Group is a nonpartisan group. So it's really devoid of any political leanings at all. And they summarize everything, the entire body of information. And it's everything from the fact that, for example, they have concluded that the overall mortality rate from COVID-19 is somewhere in the range of 0.1 to 0.4%. Far, far, far lower than we ever were led to believe that was going to be the case, and probably on par with a really bad flu season. They also confirm the data we know about children, that children are at an extraordinarily low risk of becoming significantly ill from COVID-19, almost at a 0% risk unless they have underlying disease processes. The report confirms that children are not great vectors. In other words, they aren't really the ones who spread this. It covers things like the fact that the case numbers are quite faulty because many patients have been counted 2, 3, and 4 times if they were tested more than once. It goes over the mortality data and the fact that many people in many countries, and certainly in the United States, were classified as COVID-19 deaths when in fact they died of something else. So it's a very, very comprehensive report. It's probably 30 plus pages. It's worth taking time to read if someone is really interested in getting into the weeds on the data. But the report begins with just some bullet points that are really easy, probably the top 15 bullet points about COVID-19 and what we know now that we are essentially 6 months into this.
Right. We'll encourage our viewers to check that out if they do want to see that more in detail. Dr. Victory, as always, thank you so much. Appreciate your time this morning. Take care.
Thanks, Lauren.
All right, we'll be